Welcome back here at noon. Let's take a deeper dive right now into that Johnson & Johnson vaccine pause. In a joint statement, the FDA and the CDC are calling for the pause in the administration of the vaccine after reports of a rare blood clot. 6 women have experienced it so far. It occurred between 6 and 13 days after they received that single-dose shot. Now, Dr. Jeff Pothof with UW Health joins us right now to talk more about this investigation. Doctor, thanks for being with us this afternoon. 7 million people across the country have received this vaccine. Just a handful have experienced these blood clots, the 6 that we know about here. For people sitting at home who have received the shot, should they be concerned?
Right now, no reason to be concerned. When they say rare, I think it's important to frame this up. 1 in a million, that's less likely to occur than you being struck by lightning in any given year. So I think it's important. I think this really shows how preoccupied with safety we are with this vaccine, that even in something that's happening to less than 1 in a million people, we're looking into it, making sure that this isn't something that's related to the vaccine, or if it is, understanding it.
Yeah, Dr. Fauci just said in a press conference a few moments ago that this is really, 1 in a million scenario here with a number of vaccines that have been given out across the country. There are some similarities here, I guess, when we're hearing about blood clots to what happened with the AstraZeneca vaccine across the pond. Do you know what the similarities are or what the differences are there?
The only similarity is that the AstraZeneca vaccine and the Johnson & Johnson vaccine use similar technology, an adenovirus vector, to deliver that material that helps you make that immune response. I think the other thing is, blood clots are actually a fairly common thing. So I think it's really difficult, on the surface to figure out, is this related to the vaccine, or are we just picking this up and it's blood clots that would have happened anyways, irrespective of these people getting the vaccine?
Yeah, just before we came on the air here at noon, the state of Wisconsin said they were also going to pause using this vaccine. Now, I know you can't speak for all the vaccination sites across the state here, but at UW Health, if someone has an appointment, let's say for a Johnson & Johnson vaccine coming up today or in the next few days, what should they do?
Yeah, for us, it was fairly easy as we don't have any Johnson & Johnson in our stockpile right now. But I would say, let this investigation play out. I think it'll be done relatively quickly. I don't think you'll be able to get a Johnson & Johnson vaccine here in the state of Wisconsin today. It's possible that those people will be able to reschedule. That'll be either with the Johnson & Johnson once the investigation is over, or they could be switched to Pfizer or Moderna. So right now, I'd just be in close contact with your vaccination site to understand what's going to happen if you have a vaccine appointment in the next couple days.
All right, Dr. Jeff Pothof there with UW Health in Madison. We appreciate you being with us here at noon today. Thank you so much. For the latest developments on this Johnson & Johnson hiccup, go to tmj4.com/coronavirus.